I'm just going to give you a very brief introduction to Northern Ireland, and first to give you a little bit of context for our health and social care system, which you will probably realise firstly is an entirely public health and social care system with really fairly minimal levels of private provision, private sector involvement. It's universal, so the entire population is registered and receives both health and social care through the system. Each individual has a health and care number given to them at life or when they first arrive in Northern Ireland, and that identifies them in our system for the entire life course and allows therefore sharing of records and tracking of individuals within the health and social care system. In terms of delivery organisations, we have 5 health and social care trusts for a population of just a little under 2 million. You're in Belfast, of course, at the moment. The Belfast Health and Social Care Trust is the largest of the 5 trusts and hosts all of the regional specialties. The Northern Ireland Health and Social Care system is linked both to the systems in England, Scotland and Wales and to the system in the Republic of Ireland. So the UK has 4 devolved health systems. You'll hear a bit more about the Scottish system later. The Welsh and English systems are also distinct. Because Northern Ireland is part of an island, the island of Ireland, then there are some aspects of health and care which are delivered on an all-island basis. And there is a certain amount of movement of patients across our currently non-existent border. One of the topics which has been the focus of a significant amount of our Brexit preparations. Like all health and social care systems, we are attempting to deal with both rapid pace of innovation and with a particular interest in personalised medicine. And that, of course, personalised medicine, personal health, will be the topic of this workshop. I think there are elements that we do and deliver very well, and we hope perhaps to be able to share some of those with you. I've also no doubt that we can learn from your collective experiences, and we look forward to that as part of the SAPHIRE agenda. Certainly, within our policy system, personalised medicine is a major focus both now and as we move forwards. Northern Ireland is a data-rich environment. As I've indicated, we have an integrated health and social care system. We are moving in the next 3 years to a new electronic healthcare record, or EHCR, which will fully integrate all of our current systems, which at present speak to each other and can be integrated, but are not held within a single system. So by 2022, we'll be transferring data and moving to that. We form part of various UK initiatives, Health Data Research UK, which is the UK body which seeks to promote the availability of health and social care data for research purposes, has one of its centres based in Belfast. The Administrative Data Research Centre, the other major UK initiative which provides a mechanism for linking health and care data with administrative data, such as employment and benefits records, education records, etc., also has one of its centres within Northern Ireland. We have, I hope, an engaged and receptive population who tend to stay here, and that has advantages in that it means that we have relatively limited inflow and outflow of our population and can track people over many years. There's strong leadership and a committed workforce and some important industry strengths, particularly in Northern Ireland, in the areas of data security, where we have one of the, certainly the UK's main centre for data security is based within Northern Ireland, and we are one of the have many international collaborations at that area. And secondly, in diagnostics, particularly laboratory diagnostics, so digital pathology and diagnostics in biological fluids. We have major industry strengths here. And connections and networks both nationally and internationally. We have led some important developments in terms of personalised medicine. Cystic fibrosis is common on the island of Ireland. We have one of the highest incidences, if not the highest in the world. So the cystic fibrosis studies using personalised medicines based on genetic characteristics were led from Northern Ireland. And indeed, whenever President Obama spoke about personalised medicine in his State of the Union speech, this was one of two examples which he quoted of how the future would develop. And it was led from Northern Ireland. There's also a significant focus for us on personalised cancer care, and I'm not going to talk about that because we're going to hear a lot more about it later today from Scotland. And we're fully integrated with an important UK project, the 100,000 Genomes project, which a number of you will have heard of. This was established back around 2014 and had a particular focus in doing whole genome sequencing on individuals with rare diseases. We have made a significant contribution to that project, and whole genome sequencing for rare diseases has now become part of our routine standard of care and embedded within policy as we move forwards. So this shows our research infrastructure. You'll be pleased I'm not going to talk to you about it. Janice and myself are responsible for this. It provides a strong platform to support research right across health and social care, but as I say, particularly for us with a focus on personalised medicine and in the future, personalised health. So thank you all for visiting Belfast, and I look forward to conversations with you over the course of the next day or so, and hopefully to learning a lot this afternoon from your presentations. Thank you.